Hi, I'm Carolyn Cooper, and this is Mental Health and Faith, a closer look. May is Mental Health Month. This is a great opportunity to do some self-assessment and consider where you are with your mental health. This month, I have some great interviews I'll be sharing with people who are involved in organizations like NAMI and Mental Health First Aid. We'll find out about resources, but we'll also hear stories of victory, of overcoming, of persevering through the recovery journey. Please subscribe. You don't want to miss. Now, if you're in a crisis, pick up your phone if you're in the United States and call or text 988. That is the Suicide Prevention Lifeline and Crisis Line. Now sit back and enjoy the show. Hi, this is Carolyn Cooper, and welcome to another May episode for Mental Health Month. And today, my guest is Marsha Morgan. I first heard her name when I was working as a certified peer specialist in the mental health field at Truman Behavioral Health. And her name was batted around as the person who knew a lot about trauma and trauma-informed care. And I was fascinated by that because I experienced trauma in childhood, and I just it's something that I'm very interested in. So we have a treat today to hear Marsha talk about trauma, trauma-informed care, trauma-informed practices, all kinds of terms that you may or may not have heard before. So I'm going to let Marsha start by giving us a little bit more of an introduction of who she is and say, welcome to the show, Marsha. I'm just thrilled that you're here.
Thanks, Carolyn. I'm delighted to be here too, and glad that we could get this scheduled in May for Mental Health Month. And just a little bit about my background. I've been in the field of mental health and substance use services for more than 50 years now. And really probably can tell you that I'm also a family member of folks who have serious and persistent mental illness and are substance use disorders, right? So it was in my blood to probably do this kind of work. When I started my career, I actually was working for the Missouri Department of Mental Health, and I've always worked with people who have serious and persistent mental illness and are long-term chronic addictions. That was where I belonged. That was always my fit. We were part of the Department of Mental Health for, I was there for 23 years. And then we were privatized. And when we were privatized in May of 1997, the contract from the Department of Mental Health was awarded to Truman Medical Center. And I became the chief operating officer for behavioral health at Truman. And that's how I finished my career. It was much better than I ever could have imagined. Truman afforded me many, many opportunities. And one of the opportunities that Truman allowed us to do was to really pursue becoming trauma-informed. And that happened actually in 2009 when the Missouri Department of Mental Health said, we're going to offer organizations to become trauma-informed, and you'll have access to national consultants and trainings and all kinds of things. And while I thought after 35 years I knew everything that needed to be done about trauma, I found out I didn't. And one of the very first things our national consultant said that got me on this wagon that I'm on and have been on for now over 10 years was ask permission to shut the door. Whenever you're meeting with clients, ask permission to shut the door. And I thought, 35 years and nobody ever told me to ask permission to shut the door. And yet, when you think about it, it makes so much sense, right? If you're a person who has experienced trauma and the trauma occurred behind a shut door, then shutting the door can be a triggering event and can send somebody into a real tailspin. It's like, well, everybody needs to know this. Mm-hmm. If I didn't know it after 35 years, and I did lots of trainings and I've been in the field for all those years. So I became really, really, really passionate about introducing both the science and the research about trauma, as well as then what are trauma-informed practices that we want to promote in not just healthcare, in education, in policing, in, the court system, all of those things. So that's kind of my story. That's how I got here. And I had to pursue my passion. Sometimes you take a path.
Yes, sometimes unexpected path. And it's very interesting because you'd been in the mental health field for 35 years, you said, before this experience.
Yes.
With finding out. So in some ways, the trauma-informed care mindset is relatively new. Or is that true?
It is, yes. Part of the reason people hear about armed services people having PTSD. And so it was always very much like, okay, well, this is armed services people.
Right.
This isn't the rest of us. It's just people who have gone to war. The study that was done now almost 35 years ago, was with Dr. Folletti and Dr. Anda. And what they figured out was, no, trauma is occurring to a lot of people, and it's having impact. And that's when I think people started taking a look at, when I grew up, the myth was, don't worry about kids. Kids get over it. Kids they have bad stuff happen to them, but they get over it. Not true. And that's what Anda and Folletti's study showed. People don't get over it. People have long-term consequences if they don't get the right supports.
That is absolutely true. And that was my experience for it taking 30 years from the time I had some trauma before I got the help I needed. But that's another story. I think it's going to be important to help the people who are listening and may not be as familiar with trauma and what it is and what it isn't and things like that. So I have a question I was going to ask you, and that is, I had PTSD, post-traumatic stress disorder, because of my childhood trauma, but I also have a diagnosed mental illness. And I know from my own experience and such that having a mental illness can happen even if you don't have trauma. It's right. Something different. And someone can experience trauma and not necessarily develop a mental illness. I have a friend who had severe trauma, but she never really was diagnosed with mental illness. So can you kind of help clear up the differences and the connections between trauma and mental illness?
I can try.
Okay. Or it may not be that easy, right?
Think of it this way. Think of two intersecting circles, right? But the circles are not on top of each other. So if you think of, quote, people who have mental illness, who have not had trauma, they're kind of in one part of the circle. And then if you think of the second circle, the circle on the right, and there's people who have had trauma but don't have mental illness. But then where the circles intersect, then that's the folks who I would think of have mental illness, but their mental illness may be a result of their trauma, right? It's not necessarily that they had mental illness and then they had trauma. It could be the other way. The fact is that, yes, there are people who may be diagnosed with severe depression, right? Or bipolar disorder, or even schizophrenia, or some of the subsections of schizophrenia, who have not necessarily experienced trauma. There is a genetic predisposition, if you will.
Yes.
At least as far as we know. You can grow up in a wonderful family and, two parents, and you're loved and you're nurtured, and there's nothing traumatic that happens to you, and you still may end up with a diagnosis. And on the other hand, there are people who have serious traumatic events and may experience complex trauma and don't develop mental illness. They may have symptoms of depression, but once they get the supports they need, depression may subside, right? So it's not this long-term diagnosed depression. It's more situational because we've had this trauma. What the research, what the science tells us about the folks in the middle, particularly children, if you are a child who has experienced abuse, neglect, or I call it significant chaos in the family, right? So violence, parents who are incarcerated, parents who have mental illness, I want to be very careful about that. Not always poverty, but not having food to eat, not having housing, not being stable in your school. All of those stressors do impact brain development. And so if you don't have the right supports and the right interventions, then there are parts of your brain that are not developing the way that they need to. So then you are more prone to have mental illness or to be diagnosed with mental illness, right? Because I think the science is still evolving.
Okay.
Right?
Interesting. Well, yeah, we learn new things every day. And I love that you talked about brain. I mean, what 10, 15, 20 years ago, we didn't know that much about brain development, right?
I think we thought we knew some things, but now because of MRIs and all of the imaging that we can do, we can actually see what parts of the brain are not developed and what parts of the brain are very developed. We can then design treatment interventions for people to help, because the exciting part is the brain is plastic. Different neural pathways can be developed as a result of what we know, right? So, and hopefully this will make sense to you as a music ed person. I'm such a huge believer in the expressive therapies, music, art, drama, dance. It's like you get to develop all kinds of new neural pathways that then you compensate for the things that have happened to you.
I just think that's beautiful. I was actually at a conference last week. A couple of the keynote speakers both talked about brain development, but I think that's fascinating. I think that's really important, like you said, to target treatment based on really your physiology.
Right. And that's part of why I'm on this journey, is because it's like we spent so many years in the field of psychiatry, in the field of mental illness, looking at people's symptoms.
Yes.
And we treat the symptoms, and we weren't getting to the root causes. And if the root cause is really physiological and it's about your brain, or it's about your digestive system, or it's about your heart, why aren't we taking care of that? Right? I mean, that was the part that it's like, we have to take care of what is the root cause, where it is that there's something askew, right?
Right. Right.
So I'm on a kick right now, Carolyn, and I'll own it. My kick right now is, I really believe that there are two things that should happen for people who are having symptoms of mental illness. Okay. One of them is, I believe they should have a brain scan, a true brain scan. And I believe that they should have the opportunity to really have an understanding about what is working in their brain and what isn't working, right? If you know that it's about your brain, so many people, when they have behaviors and they're medicated, for lack of a better term,
right,
they think they're bad people. They think that there's something wrong with them, and there isn't. I mean, it's like, if there's something going on in your brain and you know that you can work on it, then you have an opportunity that you didn't think you had before, because you thought you were out of control. You thought there was no control, right? The other thing that I think people who who are having symptoms of mental illness actually deserve to have is a sleep study. Because what I know about my people being people who have mental illness and substance use, is I know that my people don't sleep well. And when you don't sleep well, then you start losing it. We know that you start hallucinating after so many hours of sleep or so many days of sleep deprivation. We know that you start not being able to eat or digest your food. I mean, there's all kinds of things that happen to you. So if we know these two things, what are your sleep habits and how can we help you sleep better? And we know what's going on in your brain. Maybe we can help you physically heal.
Love that so much as a person who could use those things. Marsha, does your consulting business deal with some of these kinds of things? Or do you know, if I wanted to go get a brain scan, how do you go about doing that?
Good question. I know you can get it. I know that most of the hospitals will do sleep studies. Mm-hmm. I know that, at least as far as I know still, that at University Health, which was Truman Medical Center, that one of our psychiatrists there, Dr. Farnan, did a fellowship in sleep study. Oh. And so he is a sleep specialist as well as being a psychiatrist. And so that would, not because I have any reason to promote Truman. Please understand, I don't work for Truman or anymore or anything like that. But I know that he would be able to understand and help people, okay, with that. If I were looking for someplace to ask around about sleep, I would want to ask how do you connect sleep with symptoms of mental illness? Mm. Not how do you connect sleep with sleep apnea or sleep disorders, but what do you do to help people really address these issues around sleep? How do you make sure that our people feel safe, mm-hmm, when they're taking the sleep study? Because that's the other thing that we found as we were working with the sleep center at Truman, is so many people were having trouble with sleep. They would get referred, but they couldn't complete the studies because they didn't feel safe. Our technicians, our doctors, our people who are in those sleep clinics need to be trauma informed so that they can make sure that when people come in, they're treated by the right gender of the person who's treating them, and that people understand, how to help people de-escalate or regulate, because it's anxiety producing. You're going someplace strange. You're supposed to sleep there the whole night, and you got wires stuck to you and all that. It's like, that's not, I don't know if I could.
Yeah, that would be difficult.
This other piece about the brain, Carolyn, I haven't had a chance yet to really research the city to see where you could get a really good brain scan. But there are hospitals where it's like they have the 3D imaging, mm-hmm, and that's what you would be looking for, right? Not just a simple scan, but you're really, and somebody who really understands and can speak to, these are the parts of the brain that are not working, and this is the part that is, and this is what you need to do about it, right? We don't do any of that, but there's got to be imaging centers that do have that level of technology, because it's not new.
Right. I tell you, and I'll try to, maybe I can find some stuff and put it in the show notes when I get this posted. And if not, at least people now can do their own research if it's something they're interested in. But I do think it would be very beneficial. Marsha, we only have a few minutes left, but do you have anything that you think would be really beneficial for someone to know about, say, someone who may not necessarily have ever done anything about mental health? They may have trauma, they may not have trauma, and they've just kind of been like I was for a long time, just kind of ignored it. What would you say to that person? What kinds of ideas would you give someone to take that step of evaluating and taking care of their mental health?
That's a great question. I would say there's a couple things. Pay attention to your body, and if you're and recognize when you're not sleeping or you're not thinking clearly, to take a step back and don't blame yourself, but to think about what's going on that is impacting your ability to sleep or your thinking. It's like, take a look at what your stress levels are, right? There's good stress. You and I just had stress trying to make sure that we were here and we were on time and all those kinds of things. But when you start noticing, I can't make a decision. I'm having trouble making a decision. I'm having trouble sleeping. I'm starting to snap at the people around me, or I don't even want to be around the people around me. Then it's like, what is going on? And then that's the opportunity. Two things. If you don't want to reach out to a health professional, or to maybe you don't have a close friend, or whatever, journal.
Yeah.
Start journaling, because start recording your feelings and what's going on, because your feelings are going to come to the surface if you just start letting all that out, right? What makes us worse is when we bury our feelings.
Yes.
And so it's like, don't be afraid to feel it, and don't be afraid to reach out and say something to somebody, and to say, something's going on, and I just don't talk to your plant. I would say, don't talk to, find a person,
somebody alive.
Yeah, exactly. So it's reach out, and and sometimes it's like, you can say, I don't need you to do anything, just listen to me.
Yes.
Because what we've learned is a lot of the healing starts when we start talking, and when we start talking, then all of a sudden our head starts clearing, right? It's like, oh, that's what's going on. And I have that aha moment where now I get it, some people, for me, when I start feeling kind of off, one of the things that I have to do is I have to walk. And sometimes I have to walk miles, right? I mean, it's the physical, because the tension, what we know about being dysregulated, what we know about trauma is it's living in our cells, right? And so if we're having adversity, even if we think, oh, I can handle this, I'm really strong and I can handle this, and then all of a sudden you go, wait, maybe not so much. It's like, some people can meditate. Carolyn, I can't meditate when I'm dysregulated. I have to walk. It's like, let me walk. Let me throw a basketball. Let me do something physical, so that then I can think. When I was younger, I would walk, and a lot of times I'd be crying, and I would, and maybe I'd walk an hour and I'd be crying for 45 minutes or so. And then after I cried it all out, then I was like, I can handle this.
In just the little time we have left, I'm going to say that I think, from what you just said, it's just a really good reminder that everyone is an individual, and our bodies are totally unique. Yes, we have a lot of similar things, obviously, with anatomy and such, but the important thing is, like you said, be aware of your body, be aware of what works for you. You may have to try several things. You may have to try a lot of things, and you may have to at some point say, I do need professional mental health professional to help me. But I love what you said about just getting things started. I hope you enjoyed today's episode, and please send me your comments, questions, and even suggestions to Carolyn at ingodscorner.org. That's CAROLINE at ingodscorner.org.